We're going to have a look at what chemotherapy and immunotherapy are, and their applications. What is chemotherapy? Chemotherapy, with the basic description curing with medication, is a special medicational treatment method mostly used against the fast-growing and multiplying cancer cells which harm other healthy tissues. The drugs used with this purpose are also called anti-cancer medications. Why is chemotherapy applied? According to the cancer type and stage, chemotherapy can be applied in order. To cure cancer. To stop its spread, metastase, or. To reduce cancer-related symptoms. How is chemotherapy applied? Chemotherapy is often used in conjunction with surgery, radiation therapy, targeted therapy, or immunotherapy. If it's applied with the aim of shrinking the tumor before other therapies, it's called neoadjuvant therapy. If the procedure is done after the other therapies with the aim of destroying remaining cancer cells, it's called adjuvant therapy. How is chemotherapy given? The drugs used in chemotherapy can be administered intravenously, in the form of oral tablets or creams applied to the skin. How often is chemotherapy applied? Chemotherapy frequency and duration depends on cancer type and stage. The goals of treatment: curing the cancer, controlling its growth, or reducing symptoms. The type of chemotherapy. Your body's response to chemotherapy. Chemotherapy is administered in the form of cures. A course consists of the duration of a course of chemotherapy followed by a rest period. During the rest period, it is ensured that the body creates healthy cells again. What is immunotherapy? The immune system recognizes the abnormal cells including cancer cells and destroys them. Cancer cells are also abnormal cells, but they can hide from the immune system. Immunotherapy enables the immune system to recognize these hiding cancer cells, stops cancer from growing, and prevent tumor recurrence. Main principle in immunotherapy treatment: enabling and facilitating the immune system to recognize and destroy cancer cells. What are the types of immunotherapy? Immunotherapy agents that activate cells such as macrophages, NK cells, and T lymphocytes, which are members of the immune system. We can list them as monoclonal antibodies, oncolytic viruses, T-cell transfer, cytokines, interferons, and interleukins. How is immunotherapy applied? Immunotherapy can be administered subcutaneously, muscle or intravenously such as chemotherapy. When to use immunotherapy? Today, it is applied together with chemotherapy in early-stage cancers. It can be applied alone or in combination with chemotherapy and/or radiotherapy in metastatic patients. Thus, while the proliferation of immune system cells is triggered, the formation of blood vessels that feed the tumors is disrupted.